Morning. Thank you for joining. We're just going to wait a couple of minutes whilst others join, and then we'll kick off. Thank you. We'll just wait one more minute and then we'll start. Brilliant. Thank you. Brilliant. So thank you so much for joining us today. Welcome to West Yorkshire Innovation Festival, and thank you to West Yorkshire Innovation Festival for inviting us to host this session. My name's Natalie Record. I'm Housing Innovation Lead at Connected Places Catapult. And today we're going to be looking at homes for healthy aging, how innovation can help people live healthily and independently at home for 5+ years longer. Oh, sorry. So today's session, the format will follow the following structure. We'll first look at healthy aging, challenges and opportunities, and then into healthy aging, the role of Connected Places Catapult, and then homes for healthy aging, our program design, and then into question and answers. The session today will be recorded and it's currently being live streamed. And please use the chat function to raise your questions as we go, ready for the question and answer section. Brilliant. So for those who don't know, Connected Places Catapult, or CPC, is the UK's innovation accelerator for cities, transport and places. And we seek to connect, spark and accelerate. Our Future of Housing programme in 2019 helped us to identify 3 key areas where Connected Places Catapult could support the market and its development. We selected 3 areas from that research, so healthy aging, retrofit and innovative financing. This is the structure here, and we're currently today looking at the healthy aging stream of the Housing Innovation Programme. So we've been exploring this for over the past 2 years through our Future of Housing programme. We've been looking at healthy aging through our Housing Innovation Week in 2019. We held a Homes for Healthy Aging workshop in 2019. And then we're currently designing a new Homes for Healthy Aging programme, which will run between 2021 and 2023. And yeah, we'll be explaining about the structure of that programme, and it will launch later in the year, but it's very much on the cards. And here are a couple of reports that we've released or fed into over the last couple of years. So, healthy aging, challenges and opportunities. And this is when we were back at the office. This is our Future of Housing Week. And through that, we held a number of roundtables with thought leaders and different delegates. Over 200 people attended the events across the week. And we really started to understand the bigger picture of what the healthy aging challenges were for the built environment industry. Why it needs to happen? Well, within this next decade, 20% of the total population will be over 65 years old, and this will increase to 25% by 2050. Our source here was the ONS data. Some key challenges. So there's current lack of integration with healthcare and housing. These are some of the health issues that people, the aging population are facing, but also people of all ages. And this isn't just about the elderly. But there's this middle market that's missing. So we've got specialised housing and some sheltered rent, but there's definitely a lack of housing. 80% of the homes we will be living in 2050 already exist, and 80% of the UK elderly have very limited housing options. So this sort of raised the question to us of where are there opportunities in this middle market to help meet these people's needs and create homes that actually serve the needs of their users. Oh, that's one last fact is less than 1% of over 65 in the UK live in homes with care. So the complexity of the challenges, there's a diverse aging population, so there's a diverse range of needs. Different people need different things. There's different housing stocks. So you've got a variety of housing stocks in the UK, from sort of Victorian and Edwardian terrace properties right through to more dense tower blocks. So there's a whole host of different housing stocks across the UK today. And there's different stakeholders who are involved with healthy aging and decisions around that, from the users themselves and their families through to the NHS, social care providers, local authorities, central government, housing associations, just to name a few, public care providers, and also right through to insurers and financial services and investors. So this is a really complex challenge with a lot of different people involved in shaping those decisions. So challenges at a glance, there's health and care, there's moving home, there's adaptation, there's accessibility and community, and there's affordability. So for health and care, sorry, my slide. Yeah, sorry. Poor internet connection today. Do bear with me. Health and care. So health conditions affect quality of life, as poor housing quality affects health, and there's a lack of housing with care. Moving home, there's available housing options are limited, lack of information on available housing options, and a considerable cost of moving. Adaptation, there's old and unsustainable mainstream housing stocks, there's a lack of access to information and services on adaptation, and there's private renting preventing adaptation. Accessibility and community, most homes are not accessible, there's a lack of easy access to local services, and there's an importance of community. And affordability, there's a lack of affordable options for the majority, there's rising rent levels affecting affordability, and there's a financial burden of residential care. Some key challenges. There's a number of different challenge areas, but we picked out a couple here. Social isolation, nearly a third of people aged 65 and over live alone in the UK. 1.4 million older people class themselves as often lonely, and loneliness is associated with a range of poor health outcomes. Digital exclusion is also something that we're very aware of. 4.2 million people over the age of 55 have never been online, and with more services and information moving online given the current pandemic situation, these people are at higher risk of being left behind by the digital divide. But there's a scale of an opportunity as well. Through looking at these challenges, there's a number of opportunities, and there's also market potential. So global investors are looking to invest about 200 billion into healthcare properties, with senior living being the biggest subsector. There's over 65s own more than 40% of the housing equity in the UK. Most elderly people live in inaccessible or poor quality mainstream housing, and there's a huge market for retrofit or home adaptation services. there's a number of smart home products in Europe as well, and that market is due to grow from 8.81 billion to 13.85 billion by 2024. And our sources are there below, and I think we'll share these slides as well. So interventions, there's a number of innovative approaches emerging. We've seen senior co-housing interventions, intergenerational living, age-friendly design and adaptation, assisted living, and smart homes. Technology innovation, so with assisted living market, it's currently niche, but there's huge growth potential, and there are existing players and new entrants. So this is an illustrative small section of the SME market at the moment, but there are a number of different SMEs operating in this space, and I think a few are on the call today, so thank you for joining. Different supporting technologies include different types of sensors, so that's health, motion, occupancy, environment. There's the AI and machine learning side of the interventions and technologies. There's advanced analytics, there's voice assistant technologies, there's assistive robotics, there's digital apps, etc. So just a small selection of the things on offer in the market. There's opportunities for integrated healthcare solutions in the home for better outcomes. So this is a little bit about looking at how these different technologies can be connected in the homes, and these types of technologies are already starting to be trialed in different projects. So you can have perhaps ambient sensors in the home that monitor, motion, occupancy, and environmental changes, and you can also have wearable sensors for monitoring the movement and the key health metrics. And then those, perhaps if there was a fall in the home, that could trigger the emergency response. It also could trigger security alerts, because safety in the home is a huge concern to many in their homes. And then the information and data from that can be read by sort of the brain, the advanced analytics, and the AI to analyze that data and send it to a dashboard. And that can trigger alerts to phones, maybe triggering alerts to loved ones and neighbours who may link up to those alerts for their loved ones. That could trigger early warnings and start to sort of sense when sort of ahead of time, so predictive technology of understanding that where their risks might be falling to start to mitigate some of those problems. And then automations that it enabled through this, so to start enabling better outcomes for people in their homes. Just a few examples of where we've seen some care robots being developed. So this care at home using intelligent robotic omnifunctional nodes was a project funded by Innovate UK, and the project aimed to develop a connected system of modular robotic components that can be adapted to support the elderly with various assistive tasks. And then we've also seen the innovation department that was developed in partnership between UE and University of West of England and Extra Care Charitable Trust, developed an innovation department that modelled a real-life home to demonstrate the use of smart devices to support independent living for longer. So they're just a couple of examples, but we know there's another, a lot of other ones that have currently been tested in different living labs, healthy aging living labs across the country. So really keen to hear on more examples of those from anyone attending today, and to keep this conversation going. So the next part of this presentation is looking at the role of Connected Places Catapult in this healthy aging ecosystem. So whilst there are a number of identified opportunities that we've just set out, there are several barriers preventing healthy aging innovations to scale in the UK. We're currently designing a Homes for Healthy Aging programme to contribute towards the UK government's goal to support older people to live at home healthily for 5+ years longer. So to do that, we will test and demonstrate UK-based and international technologies, and will focus efforts on delivering replicable, impactful solutions to the UK's healthy ageing challenges. So the Catapult will bring together key players to launch test beds in different parts of the UK. We will leverage a broad housing network. We will use our place-based expertise and domain knowledge, and we'll use our role as convener and our links with key stakeholders. We aim to deliver through this programme workable solutions to healthy ageing challenges, an ecosystem of scalable solutions delivered by the UK PLC, and we aim to deliver sort of proven models for further investment and rollout for local authorities, the NHS, central government and others. We will use and build a base of evidence and insights to ensure effective solutions are delivered. Ideally, we sort of, Connected Places Catapult has a human connected design at its heart, and it's the centre of all of our programmes. We would typically use workshops and different user research techniques. That's been limited at the moment, of course, but hopefully as we move out of the pandemic, we'll be able to use a range of tools again. And we're going to develop a technology ecosystem that can solve healthy ageing challenges in a scalable way. So to create this programme, we'll be looking to work with local authorities, so looking to be part of a UK-wide programme of innovation. We're looking to partner with SMEs who may have a relevant solution, looking to housing providers who may be looking to advance their innovation strategies, investors seeking promising innovations to invest in. These are just to name a few of the scenarios of people who we'd like to talk to anyone who's interested, but these are the kind of scenarios where we can see potential partnerships emerging from this programme, and of course universities as well. So the programme design itself, so before we can design the wider programme and launch and design a testbed framework, we're currently undertaking a series of short discovery projects to deepen our understanding of healthy ageing challenges and opportunities. I joined the Catapult in November of last year to pick up this programme and design it and develop it. My background's in policymaking. I'm a town planner, and I was previously at the Ministry of Housing, Communities and Local Government, where I led on digital housing and planning policy. When I joined, I sort of met with lots of different people across the Catapult, and this is definitely a cross-Catapult initiative from Connected Places Catapult. And then I'm in the built environment team, but I'm working with colleagues in the urban technology team who are experts in creating test beds and deploying technologies, and all other teams involved too. So this is very much a cross-Catapult programme. So we as a team really saw, looking at our previous research, that really got us to the point where we saw there's a lot of feasibility in investing in healthy ageing and further exploring that. But yeah, we've come to this point where there's still a number of questions to answer before we can roll out the programme, before we can decide where to deploy technologies and help create test beds. So we're very much in this sort of learning discovery phase at the moment. We'll create a number of hypotheses out of this phase, and then we will be able to test those hypotheses as we move forward into the rest of the programme. So we're very much designing and being led by insights and user research in order to shape the next steps. So a key focus will be upon the sustainability and transfer of knowledge from the programme to support healthy ageing innovation and stakeholders beyond the lifespan of the programme. So sustainability is a real key point for us, and we don't just want this to be a programme that only has impacts, for the lifetime of the project, and we really want to be able to push things beyond that for the wider built environment industry and users beyond this time. So, as a part of this discovery phase, we've partnered with a number of academics, SMEs and other industry players to help us answer some of these questions. So the first sort of work package or project that we're working on at the moment is with Pro-Social Place, our academic partner, who are out of the University of Liverpool. And so their experience is in evidence-based design. They're a team comprising urban design, well-being, health psychology, and health geography. And the types of questions they're helping us look at are, what is the relationship between place and healthy ageing? Where are there commonalities and where are there differences across the UK? We're going to use this research to really start to understand where there are, of course, different, every place is nuanced and different, and there's no one size fits all, but where are there patterns that emerge that perhaps we could support a testbed that is in one part of the country with certain challenges and help the testbed partners to inform them of the types of challenges that their residents may experience in those places, and how we could better support healthy ageing in those places. So this is our sort of place-based challenge work at the moment. And then we're working with the Helen Hamlin Centre for Design from the Royal College of Art, who are a global leader in inclusive design, design thinking, creative leadership, and they work across government, business, academia, and the third sector. And we've been partnering with them and their expertise in understanding end user challenges. So looking at what challenges are experienced by people aged 65 and above in their homes, and how do these impact upon their health, and sort of looking at what are the genuine user needs for homes for healthy ageing, amongst other questions. So that's a really key part of the puzzle for us. Another sort of question we're exploring just as a team, we are all aging. Should we be focusing on homes for people of all ages to create more healthy homes, which would in turn serve the needs of everyone? So this question about what age of people to be focused on in this programme has been quite a key question, and one we're exploring as well. We've also partnered with the BRE. So for those who don't know, they are the world leading multidisciplinary building science centre with a mission to improve buildings infrastructure through research and knowledge. So we've asked them to help us look at the housing stock and sort of building fabric challenges. We're looking at sort of what are the most important characteristics or housing related issues in homes that relate to health and well-being, and what's the scale of the issues in the existing UK housing stock. There's some of the types of questions we're exploring there, and then we'll move beyond that to say, is technology the answer? Or it's not that we don't want to be, even though we want to support the use and see the value in innovation and these tools, but we have to be led by needs rather than technology led. So that's very important to us. And we're also looking at what are the barriers and opportunities, like technical, organisational, etc., to retrofitting solutions, tech or otherwise. So if, for example, with the building fabric, what are those barriers to actually, say in a Victorian building, what are the key barriers to retrofitting, say, some of the care technologies, or what's the width of the doorways, so that we know, so that if one of our testbed partners are deploying technologies in homes, what does that look like, and what are those key challenges for those different types of housing stock. And then sort of moving on to look at the ecosystem itself. So what innovative products and services are already available to help support health and well-being in homes from the UK and internationally, and looking to who else is working on similar programs within the ecosystem. So we've got a team working at the Catapult comprising sort of service designers and user researchers who are currently looking to interview different people working in this space to really understand the barriers and opportunities. And then we're just really keen to look at this data governance and ethics side to support these test beds from when they're launched. So looking at what data governance and ethics frameworks need to be put in place to support a healthy ageing test bed, and how will users engage with that data. There's some really thorny issues around data and ethics, and they're not to shy away from, but we really want to make sure that that's a key component of our programme is that we're really leading the way in thinking about these issues so that we can really advise and create a playbook for our testbed partners once they're launched, so that they're well equipped to deal with these issues. Oh, and we're partnering with Projects by If on that piece of work, who are our SME partner. They're delivering an amazing piece of work. They help sort of organisations de-risk future products and services and help to build trusted brands around data responsibility. So really enjoying working with them on this. And so sort of looking towards these sort of final questions of also who will pay to install these healthy ageing innovations, and how do we develop an industry-wide sustainable business case to support the scaling of innovative healthy ageing solutions in the UK? So that is a number of questions that we're looking at in this quarter. We will be then disseminating all this information as a team, and we will be moving towards a launch once we've designed our programme. So that will be officially launching later in the year. And we'd love to hear from you, so please do get in touch if you're interested in getting involved in some capacity. Yeah, just be great to meet you and hear from you. My email's on the next slide. We'll be taking questions and answers now. But yes, just great that you've joined us here today as part of this festival. And yeah, keen to move on to question and answers. Thank you. Just going through them now. So this is a question that's come through. Modern homes have a trend towards wet room bathrooms and walk-in showers, and by including a tiled bench, it can function as a seat for those who need one. These are enablers for aging in place, but also just a nice bathroom for a house. What design innovations would the panel like to see mainstreamed in home design? Very interesting question. What design innovations would the panel like to see mainstreamed in home design? So I think why I'm excited about this work, this Building Fabric Challenges work with the BRE, is to really identify where what those common challenges are, and then led by that need for certain, so when we know that there are certain challenges like a bathroom, we can really start to see what products and services are already available in the UK and international market to meet that need, and then sort of be led by that, so led by the need itself. Design itself is, so we're looking at technologies and we're looking at design, but we're mainly focusing on technologies here, but hopefully having, through trialling different technologies to help certain problems, we're hoping that will also inform some design recommendations. So early stage on that, but a bit of an answer there. Next question. So, lots of questions coming in. A good question here was a reflection. All these technology related aspects are great, but perhaps as or more important are community, friendships, social connections and environment, and connection to outside world, green space, flowers and recreation. Completely agree. And I think a big part of our place-based work, which is why we're looking into that at the moment, is what kind of urban environments or rural environments, what sort of natural environment supports healthy aging, and what does the ideal sort of healthy aging place look like that best supports the well-being and needs of people, and also what are those social connections and structures around what are those social connections around people that help support their everyday lives, and really sort of looking to enhance those too. So yes, definitely agree with that. Lord Crisp has written a book called, is that my bookshelf? Health is Made at Home, Hospitals Are for Repairs. And he joined us for a podcast a couple of weeks ago, so it's on our website, but really recommend that. And he very much talks about health prevention and the importance of community. So we're really keen to explore that in this programme. Another question here, what smart home products are currently being implemented or evaluated? That's a really good question. There's a number of different case studies across the board, different councils. Some have deployed sort of technologies to help people around sort of risks of slips, trips and falls in their homes. There's quite a few tools like Safe Steps, to name a few, but there's some really interesting pilots that have gone on with that, where local authorities or housing associations are starting to trial these technologies. So perhaps getting healthcare providers to use certain technological tools to help monitor health of their patient, and then using that to start using predictive analysis of where problems may occur. There's also sort of energy difference of pilots around energy in the homes, and monitoring sort of damp in homes and sort of the environmental type issues, to try to start preventing sort of longer term health problems from damp and mold. So they're just to name a few of the challenges, but really seeing some interesting work come out of them. And of course the care robots type part of the puzzle, which is also interesting. Just looking at the other questions. Yeah, so a question here of from someone who's looking at pioneering, connected to community and part like retirement village. How can we help? So yeah, very much please do get in touch. I'll share my email again, but it's natalie.record@cp-catapult.org.uk. But yes, I will share it on the screen at the end. But yeah, do get in touch. We're currently designing this programme, so as I said, keen to hear from others who are working in this space and seeing where there's commonalities. We'll also start to keen to host some more roundtables and get the conversation going. So keen to hear from you. Any other questions? There's been some really interesting ones. Just checking here. So I think I'll leave it open. Sorry, I missed the whole section. I'm being a rookie here. Right, so there's quite a few more questions here. When will the results from the research with academic partners be available? Good question. So we will be sort of completing that work in the next few weeks, and then we'll as a team start to look at, there will be commonalities amongst the pieces of work, because the time, the way we had to sort of start to look at this and kick off with designing the programme, we've got different work streams. So yes, we'll be sharing insights as we go. Some of them will be combined, and we don't quite know what format they'll be in. They might be in reports, or they might be in a series of workshops or seminars. So we'll keep you updated on the website, and also on Twitter and LinkedIn. So yeah, I don't know if you're on Twitter, but if you follow at Natalie_record, and I'll make sure that I keep people updated on where that research is at. Can you say more about data governance frameworks? Much of these improvements and decisions are to do with the collection of all types of data. Yeah, so really really important question there. So at the moment, we're very much looking at who the users of this data will be and where that data might live, and the kind of data sharing agreements might be in place. My previous work at the Ministry of Housing was looking at data in the larger scale of sort of the planning reform programme, and how do you deal with data governance around planning, the digitalisation of planning. And I think there's similar principles across the use of data in any transformation of any industry. So we're also looking at what is good practice in other industries, for example, what's happened in the banking industry. That's sort of been the way that's been transformed is with such personal data is quite an interesting thing to look at. And we're looking at what's gone well and what hasn't gone well. So we're very much in that discovery phase, but we will, we think it's very important, and I'm very passionate about this being central to our programme and being really wise around this. So we'll share those insights when we're ready, and if Project Bias have had a look at that with us, and that we start to build that picture up. Next question: what smart home products are currently being implemented or evaluated? I think I answered this before, but yes, there's different, we're sort of breaking it down to, there's different products around the sort of home related challenges around the physicality of the home. So there's sort of, home environments and damp and mold and physical building fabric things. And then there's the sort of the people related challenges. So how does it help people live in their homes better and more supported? So, how do you look at digital inclusion? There's a number of new tools for that too. And there's social connectivity and tools to help with loneliness and all sorts of challenges that people experience in their homes. And then there's the location-based challenges about connectivity to amenities and supporting people and their needs to live healthily in their towns, villages and cities. Next question, I'm just looking through here. How do you encourage the supply side, the house builders, when the cost of installing the innovation may increase the risk of making profit? It's a really important question, and one that we're definitely looking into, because from our initial research, we saw that as the big barrier to scaling, because there's a lot of these technologies and solutions in the market, but we're not seeing scale, we're not seeing sort of transformation in the wider built environment industry. And we understand it's a question around who is the customer and who pays for this, because it's such a complex ecosystem of stakeholders involved. There are questions around who should pay. Is that the insurance company? Is it the house builder themselves? Is it the end user? So through this programme, that's a big question that we're keen to ask, and we're sort of really hoping to help create a sustainable business case that the industry can use to help to scale this. So it's a big challenge, and we're aware of that, but I don't see how, without helping to solve some of those questions or those that sort of mechanism, then I think that we will constantly struggle to see transformation in this space towards healthy aging, because it will cost more. So we do need to look into that. Are there learnings and initiatives that can be built upon from other countries? Are joint initiatives being considered across nations? Yes, really good question. So we are looking internationally. We've been very much looking at what other countries are doing, and we want to continue to do more so. So keen to hear from others who have interesting examples or working in this space in other places too. I think it'd be really important because the issues are not the issues, the opportunities are global, and you know, it's everyone's aging, and so governments across all countries are looking at this, and it's a really important space, and there's a lot to learn from each other. Of course, there's differences in country as well, but yeah, so very much looking at other places. We were engaging with the Spanish government the other day around this too, and hearing examples of how Spanish SMEs are getting involved with this space. And also in Israel, there's a lot of new innovations coming out there, and they're quite very progressive in implementing them. So yeah, very, very keen to look at that, and I'm definitely starting to really explore those options myself too in my own homework. Where innovation tests would be, where would innovation tests be held? So we're not quite sure yet. That's part of this design program. So we haven't launched the program as such. We were very much in this design phase. So we will be led by where the challenges and the needs are. So that's why we're looking at these place-based challenges. And then we want to, we'll partner with about 5 locations. So keen to hear from local authorities or housing associations across the country who may be looking to deploy a test bed. And we'll select 5 locations, and then we want them to be representative of the different healthy aging challenges that we're facing in the UK. So yeah, very much room to shape that at the moment, and we'll have a launch event when that's all been decided. So brilliant, we're nearly at time. It's nearly 1:45. I don't know if there's any other questions. Brilliant. So I think there was one more around data governance, but I can't see it. So a comment rather than a question. In terms of data governance and ethics, as part of some work, you concluded that it should be the residents in the home who control their own data and who has access to it. Yes, very much we are exploring that. So keen, please get in touch if you want to help shape that work as well, and as we write this playbook to share insights with the local test bed partners. Brilliant, thank you everyone. So I think we'll wrap it up there. Really grateful